welcome all my viewers once again today on Beyond Sugar channel. We are doing today's program and telecasting it live on our social media handles on YouTube and Facebook. And I'm your host, Sanjeev Mehra. You know that we have been connecting with you around various topic on diabetes management. We are sharing with you on a daily basis a lot of information which is useful for you. And at the same time, we also invite leading doctors from across the country who can talk to you as a friend and who can answer the queries which you have in your mind, which you have been openly, asking and putting us on the chat. I'm very happy and very glad to welcome Dr. Vaishali Deshmukh today from the beautiful city of Pune. Welcome to the show, ma'am. Swagat hai aapka. So today we would be, taking up a very interesting topic and a very important one as well. And we all undergo stress and stress due to various reasons. Diabetes, of course, has a very strong correlation with stress and vice versa, both ways. Managing, stress very effectively is extremely important for people with diabetes. So today we will talk to Dr. Deshmukh on this subject. But before I start taking your questions, let me formally introduce ma'am. She's a renowned personality in Pune and among the most senior endocrinologists of our country. Currently, she is working as head of endocrinology department at Dinanath Mangeshkar Hospital at Pune, and she's also assistant professor of endocrinology at BJ Medical College in Pune. About her academics, she has participated in more than 60 clinical trials and has more than 2 dozen publications to her name. So you know that we are talking to someone today who is very experienced, and we can truly believe in everything what she has to say to us. She's also a founder of an NGO Sphere, which has a special interest in mind body medicine, neurobehavioral endocrinology and endocrinology in women. So that's her special interest. And of course, she has many awards as well to her credit. So we are very, very privileged, ma'am, to host you today and have you on the channel for our viewers. Thank you for coming here today. Let me, give the stage to you now for your opening comments on this topic. और अगर आप हमें बताना चाहें to begin with, what is stress all about and anything, on this subject to open with.
Yeah. Thank you, Mr. Mehra. And I would first like to thank Astra for inviting me here for the second time. I think the first time we spoke last year was again on a very interesting topic, and it was a very yeah, fruitful interaction with you. And I'm sure audience must have enjoyed it. And today also, I look forward to having a excellent interaction on an important topic of stress. So, coming to your question about stress, we hear this word from a 1 year old child to 100 years old. I'm stressed. So, you can see that a kindergarten student also will tell you that I'm stressed. So, stress is a inevitable part of life. So, what we say is that when there is no stress, the person is dead. So stress has to be there when we're talking about life. The question is about how much of stress and how much is the eustress. Eustress is adequate stress. So stress is something which we call in a very simple language of tension. Tension bologe. So tension is the force applied against a resistance. So abhi ye stress, if you have to relate it to diabetes, the definition is very vast. Like we are not talking only about psychological stress here. We are talking about different stress. So the stress of high sugars, the stress of having a sugar related damage in the body, which we call as oxidative stress. Then the stress of having an economic burden, the economic stress, the stress of getting disturbed, that is disturbed that it's a lifelong disease, that is the distress. And apart from that, we are talking of physical stress where patients cannot devote time for exercise, can't devote time. So they are so occupied with their physical lifestyle that they are physically overburdened and overworking. And beyond this, unfortunately, the whole disease is known to affect the immunity. So there is something called as the immunological stress. You understand? So stress is a vast definition when we are talking about diabetes. So we are talking of multiple stressors put together in a diabetic patient, and that encompasses the definition of stress. So some patient of diabetes would say, madam, my sugars are perfectly all right, I'm not under any stress. But when you have diabetes, your immunity is already under stress. Your body systems are already under stress. So we have to understand that stress is an inevitable part of every diabetic patient. Whether they feel that stress or no is a different thing. So psychological association may not be always there, but yes, stress is definitely there. So this is what we need to really understand and tackle it.
I think that's very important points which you highlighted, that it's there in various aspects. It can be there, and we need to understand all these aspects very well. But as you also mentioned, ma'am, that this is there, it's a part of life for everyone, and you also talked about that what is adequate like level of stress, and what is more than adequate. So when does a person he can identify that, or he can he can find out for himself that the level of stress he is undergoing right now are more than adequate, and when should he be seeking help?
Okay, so let me just exemplify it. Normally, stress is a inbuilt safety mechanism. So it's a mechanism which God has gifted to every person, so that the person is saved from injury, from you can say any danger. So that is why when I see a snake, I run off, or when I touch some hot instrument, my hand is taken up because that stress is perceived by my body. So if that happens appropriately, then that is appropriate stress. But if there is something that there is no snake in front of me, but I'm still running away, I have that fear, that phobia, and that fear is abstract, it's not seen in front of me, and still I continue to perceive that stress, that is abnormal. So there is something which I don't really see or don't really exist, and I still continue to have the same response of fear or running away or fighting that particular thing. That is the problem where stress gets in all the pathologies, and that is how the sugar rises, that is how the blood pressure of a diabetic patient rises. That is how,
Mhm.
so a diabetic patient fears कि अभी ये मुझे जिंदगी जिंदगी भर शुगर की दवाई लगेगी. It may not be true. You may see that remissions are common. You see that if the lifestyle is good, the diets are improved, they might get better, the pill load might come down. But the abstract fear that this is going to remain with me, the fear that I am going to be lifelong affected by this, my life is going to suffer, all this is going to be perceived as stress by the body. And when we are perceiving stress, there are two things which get activated in the body. So, any normal person who feels stressed, there are two systems. One is the hormonal system, and second is the autonomic system, that is the nerve system, which gets immediately, you can say, activated. So, it is like geared to make the person fight or run away, both ways. So
Mhm.
both these systems get active and they cause some benefits and they cause some drawbacks. So the benefits are okay that it makes me run off, but the drawbacks is that my sugars will rise, my BP will rise, I might be prone for a heart attack, I may be prone for some other ischemic event, and that is the worry when stress comes into picture.
All right, so I think for our viewers, Dr. Deshmukh has explained the scientific, how scientifically the whole mechanism of stress works. I thank you very much for helping us understand this. But I think for commoners, for our people, it's a good thing to have stress. What she says first, and it safeguards us from many things. But I think it becomes bad when we develop a fear about something or a phobia about something, and we are constantly thinking that something may go wrong, or I may be at risk. So I think those are the things, when it starts happening to you or to anyone, then you may think that okay, maybe I am overwhelmed, and I am stressed out, and you may need some help at that time. Ma'am, after understanding that how stress can be, manifested in different ways, especially जो patients diabetes के हैं मैम, so उनके लिए अगर stress अगर उनको अगर होता है, so what can be the negative consequences, क्या हो सकते हैं उस patient के लिए जिसको diabetes है?
So you see that most of the time, any stress is associated with an element of anxiety, and it's associated with some fear as well as some depression. That is sad हो जाते हैं लोग. उनको बुरा लगने लगता है, they start empathizing with themselves, they start pitying themselves. So yeah, there is lot of emotional change which occurs as a result of stress. So that upsets the whole behavior of the diabetic patient. So it will affect the eating habits, the way, suppose the patient is depressed, they tend to binge more on sweets, or they will tend to neglect their own health, or they would forget their pills, they would forget their medicines. So the attention of the diabetic patients towards the illness and taking care of that illness goes down significantly when stress comes into picture. Secondly, there is a some people just give up. Like there is a sensation of कि burnout हो जाता है, मैं कितनी देर तक भागूंगी, कितनी देर तक ये देखूंगी, so I will give it up. So that sensation of giving up also comes in, and then there is a sort of negativity which sets into the patient, and that takes you into a negative spiral. Third important point is that stress translates into some physical changes, like your BP starts shooting up, the pulse rate starts going up. So the patient might feel palpitations, might feel symptoms which are actually manifestations of stress rather than the disease itself. So most of the times you see that diabetic patient would say, "Madam, यहाँ दर्द हो रहा है, वहाँ दर्द हो रहा है." You see the sugars are perfectly controlled, but the pain is not gone. The pain is not only physical; it's also emotional. The pain is emotional, which is translating into the physical pain on the body. Your nerves are also affected, your brain is also affected. So that is why your perception also changes. So I might perceive something which is painful as more painful when I'm stressed out. So what I mean is that the understanding of that particular sensation also changes in a condition of stress. Sleep gets hampered. Sleep gets hampered, addiction comes into picture. So person may get addicted to alcohol or smoking because of stressors that the person faces. And all this effectively also translates into a economic burden where the medicines, the number of doctor visits, the hospitalizations, everything increases. Even hypoglycemic risks can increase because they tend to eat less or they tend to eat erratically. So you can see that the whole life of the person can get disturbed when the stress is not handled.
So they can actually be many consequences of stress to someone who's having diabetes. Now we know, ma'am, that diabetes causes stress, and you talked about various aspect. Now, does stress also leads to increased diabetes or deranged blood sugars? Is that also true, or does that
Yeah, very
happen?
much,
Or
very much. I think that's a very important question, Mr. Mehra, that we all know that the ominous octet of diabetes, I am sure that even our audience knows that there are different organs which are involved when diabetes occurs. And the commonest organ which is causative and involved in diabetes is the brain. So when the brain is overthinking or when you have stress in the brain, that is the time more sugar is likely to be produced by the person's whole system, the metabolic system of the body. So there is more gluconeogenic hormones, that is the hormones which produce more glucose in the body. And that is why the person feels more stress, more sugars, and that sugars, what we call as stress diabetes. You see that acute sudden stressors in the family or in the person, most of the patients, they would have a heart attack, and that would be the time when they would be detected diabetes, because the body faces that stress. So stress can cause diabetes in a person who is already prone for it. So there is a good chance that this person might develop diabetes if he is stressed, as compared to if he would have not been stressed, he would never develop diabetes. So it's an important factor, and along with stress, anxiety and depression also are important causes for occurrence of diabetes. So associated factors also, yeah, lead to occurrence of diabetes.
okay, so I think these are some very important points she has touched on. That if someone is having an increased stress which is unable to handle or is leading to anxiety or depression, then it has its own consequences, and there are scientific mechanisms inside the body due to which someone may get diabetes, or if he's already diabetic, then this may increase or the situation may worsen. So it is extremely important for anyone with diabetes or even without diabetes to manage stress effectively. So this we understand, ma'am, from you that there is a problem, and it's positive as well, but then if it is someone is overwhelmed, so we have a issue at hand. And therefore, I think my viewers would be very keen to learn from you as well, that how to handle this, or even before that, coming to handling, how to discuss these things with their doctors. I want to learn from your experience, that when patients come to you, do they talk themselves about they undergoing stress or depression, or what's your advice to patients on this, that how they should be discussing these things with their doctors?
I think this is a very relevant point because most of the patients and even normal people, even us, we are scared to open our mind to others. So basically, when I talk to my patients, I ask them few things. Like if a diabetic patient comes to me, I tell them that there are five important things in a diabetic patient's life. One is whether he is eating well, if he is eating right and eating well. Second is whether he is sleeping well. Third is whether he is exercising well. Fourth is whether he is addicted to anything, drugs, alcohol, or smoking, whatever. And fifth is whether there is any psychological stress. So I think when I'm talking about all these things, obviously the person in front of me tells me where he is going wrong. So that's the way that most of the patients would open up, that they would tell us that, madam, this particular drug or alcohol, and that's why probably my sugar is rising, or I have a stress in the family, or I am not able to sleep well, I'm not able to follow diet. So I think it's easier to understand. Secondly, there are certain symptoms, like most of the patients would have failure to control their diabetes in spite of you giving n number of doses of medicines and insulin, high doses, and then you're wondering what is the cause. So you're looking out for stressors now. So we are looking out for infection stress, we are looking out for psychological stress, we are looking out for anything in the familial stress. So we are looking out at different stressors which are probably not allowing the sugars to fall down. That's the second way that you look into. And third way is that most of the times patients come with symptoms of depression and anxiety. So you can ideally diagnose stress as a consequence of that depression or anxiety symptom. And then these are the patients where usually the either the psychiatrist has seen them primarily, or you are referring them to the psychiatrist primarily for controlling these problems. So all these scenarios, and I think all of us as patients should be very clear enough to our family doctors or our physicians to open up our psychological mind, because mind does have an impact on the sugar control in a significant way. And we have seen that as soon as the stress is tackled, the number of medicines come down, the sugar comes down very well, patients are happier, the quality of life is better, sleep is better. So I think you should definitely talk about these things with your doctor.
All right, I think that's very well advised. So I think the bottom line, as Dr. Vishali says, that if you have any symptoms, और आपको अगर खुद को लग रहा है कि आप नॉर्मल नहीं है और ज्यादा स्ट्रेस लग रहा है आपको, या ज्यादा ड्रेन्ड आउट लग रहे हैं, या कुछ एंजाइटी लग रही है, सो अपने डॉक्टर से बात जरूर करें. प्लीज शेयर वट एवर यू आर गोइंग थ्रू with your diabetologist, with your doctor. He will be able to, or she will be able to find out after talking to you, that what are the triggers for this, and then would be able to help you as well. But if you don't talk, then it will never get resolved also. So please go, feel comfortable, and open up your mind with your doctor, and they will help you. You mentioned, ma'am, in your comments about this whole, that mind has to be healthy, and then it will lead to medicines also coming down. And I know that you have been a strong advocate of, and working a lot on mind body medicine, and with your NGOs, and with a lot of programs which you do. So can you throw some more light on this, that what's the work you do in this space, and how does this managing this whole ecosystem of mind body medicine, does that help managing the stress effectively?
Yeah, so I think I'd just like to highlight the importance of mind body medicine. See, what is mind body medicine? It's the ability of the mind to affect the body in a positive way. So, it is how mind can help the body get into a positive mode of health. That is what is mind body medicine. And that is what we are advocating. Now, the best advantage of this is that this is nothing like a costly medicine. It is easily done, so you can do it anywhere. You can do it at your home, in your office, in your clinic, wherever you are. Then secondly, anybody who is trained at it, there may be a say 10th pass person or a 12th pass person or any person with any qualification or training can actually advocate it. So you don't need to be a trainer or a teacher or a you can say qualified person to advocate it. So that's the best advantage of mind body medicine. What it actually tells us is that to every angle of treatment for a diabetic, or for that matter all chronic diseases, even hypertension, ischemic heart disease, you need four things. You need a good diet, you need a good exercise, you need a good medical control, and you need addiction control. And beyond that, what you need is relaxation. If you don't have relaxation added to all these basic things, it's not going to benefit. So relaxation is a key component of therapy. And if you don't offer relaxation or give relaxation to your patients or to your body, you're not going to benefit with that. You've seen this happen with so many athletes and so many gym trainers, that they exercise a lot, they follow a healthy diet. In spite of that, they will have uncontrolled sugars, uncontrolled blood pressure. Why? Because relaxation is equally important. Relaxation gives in more parasympathetic tone, that is a cardioprotective tone, where the heart is protected by relaxation. So that is why the importance of having a afternoon nap, a mild meditation session, a deep breathing session, whatever you can do in your own aspect. So a mind body technique, whichever is applicable to you. Now what we do in our practice is that we ask our patients what relaxes you. Now if something like music relaxes you, please do that for at least half an hour a day. If meditation relaxes you, please do that for at least half an hour a day. If sleeping relaxes you, please see that you sleep for half an hour a day. If you feel that deep breathing exercises or yoga helps you, please do that. If you feel trekking helps that, you please do that. So something which relaxes your body. And if you really can't, there are a lot of patients who really don't know what they want and what relaxes them. In that case, we have certain techniques, that is we call as progressive muscular relaxation techniques, which we teach our patients in our workshops. And these are scientific techniques which help us to individually relax the person's each and every muscle group. And this is how the patient is able to relax voluntarily over a matter of training. And it's a job which can be trained and easily learned by a person. We have mental health trainers also with us. Actually, we have certain psychology students with us who have been trained on this. So they function as my mental health trainers. We call them MHTs, and they do a good job of counseling. Most of our patients tend to open up to them better than to us, because probably they are more amenable to listening and changing their psychology. And I think it's done wonderful jobs for our patients, and that's a very good aspect, that our patient needs to know that they need to relax also.
Hmm. So that's very, very interesting. I think which you shared with us, and I think you have been doing a lot of work on this. So I think more centers, more doctors need to be applying this technique, and for patients as well. I think they need to go and talk to their doctors to understand that how to manage stress effectively through this method. And as Dr. Vishali said, that two things, that a positive mind and a healthy mind will positively impact the body as well. So it's very important to have a positive and a healthy mind. And secondly, uh, I think we all know that what relaxes us the most, and probably your doctors will find it from you only and then advise you. In case still you are in a blind spot, you don't know, then there are of course techniques which your doctors would know to find that out. So one is about relaxation, Ram, and you also mentioned couple of things around that how lifestyle needs to be managed and how diet needs to be managed. Maybe if we can learn from you little more on for our viewers, that what are the lifestyle modifications they can do to manage a stressful situation.
Okay, so as I told you, the five things, the first important is the diet. I think I can see some questions also, which fruits the
Yeah.
diabetic patient shall eat. And so here you need to understand that you need to follow certain principles, that everything in green is good for a diabetic patient. So everything that looks greens, green leafy vegetables, green fruits, green salads, green sprouts, everything is good for diabetics. So you can have that in plenty as free foods. Of course, you can't fry them and sweeten them. You have to make them, cook them healthy. Second is everything in white is supposed to increase sugars. So sugar proper, salt proper, then rice based stuff, the high glycemic index food, maida, all these are known to increase sugars. So you need to rough about understand that your diet needs to be more green. So I'm giving you the gross principle. I'm not a dietitian, but in short, you need to follow more of a green and a healthy diet. And beyond that, you ensure that the fiber content of your diet is very high. So how will your fiber increase? You need to have at least 5 greens every day. So you have a fruit, you have a salad, you have a green leafy vegetable, you have a vegetable and a sprout, and you have got your fiber for the day. Then, how do you take care of your proteins? You have one pulse, you have one sprout, you have one milk product, and your proteins are taken care of. If you're a non vegetarian, you can have eggs, you can have fish, chicken, and your proteins are taken care of. Then you think of the carbs, because carbs are in excess in the body, that's why, and the patient cannot handle carbs. So that is why the patient is diabetic. So carb has to be the lesser portion, it has to be more complex. So preferably millets are preferred, those with husks are preferred, those which have high complexity, that kind of carbs are preferred. So preferably eating out needs to be avoided in most of the scenarios. Preferably eat home food, home cooked food, whole grain food, and preferably you should be avoiding eat outs and junk food. So wherever you have maida and other stuff, that should be avoided. This is for the diet. Regarding exercise, again, you have the same kind of a rotation. You have flexibility exercise, that is keeping your joints flexible so that you are able to move every part of your body. Secondly, you need to have weight trainings, that is muscle strengthening exercises, because sarcopenia is an important part of the diabetes. So muscle loss is very well known in diabetes. So you need to preserve that muscle. Third thing is you need to lose calories. So you need to have a aerobic training. And fourth is you need to have relaxing exercises like shavasana, meditation. So you need to rotate these exercises every day. You can't be following only one type of exercise in a long run, because it's not going to benefit you in totality. Third important thing about addictions, all addictions are bad for diabetics, whether it is gutka, tambaku, mishri, smoking, drugs, vaping, and alcohol, whatever form, whichever form. So avoid it as far as possible. If you can't avoid it, minimize it. I would not recommend any addiction as a doctor, but try to cut it down wherever possible. And then, as I spoke, lot of mind health techniques. So mind body interventions, whichever you like, you can choose, you can train yourself. You get lot of educational videos even on the net, and I'm sure that there are a lot of schools which teach all these things. So you have vipassana school, meditation school, yoga school, and many more which teaches you mind health techniques.
Yeah. And you can, of course, listen to Dr. Vishali on Beyond Sugar as well to learn that.
That's
uh,
so nice.
uh, so I think she has explained to us everything, that how relaxation techniques need to be applied, what needs to be done in food, dietary habits, what to take, what to avoid, and in detail, she also talked about the lifestyle modifications like exercises and about addictions, that why should we, leave them completely. And there's multiple things which have been told by her, just in case. The good thing is that you can always, after this program is over, rewind this, let's listen this again, in case you missed out anything, or you are overwhelmed. uh, but believe me, and trust us, like, with her experience, whatever every word she is speaking has a lot of weight on each and everything, on all these 4 5 aspects. So go back, listen to her again, and make ourselves, let's make ourselves wiser on this whole thing. What about medications, ma'am? Do you, if someone, let's say आपके पास कोई patient आता है and I'm stressed out, depression हो रहा है मैम, anxiety हो रही है, or do you use medications also for that? And what, this is one of the fears also of patients. Many a times they don't tell to their doctor. उनको लगता है कुछ depression की दवाई भी मुझे दे दी जाएगी, and then it will remain with me lifelong. That's the one of the thoughts which people have. So what is your take as a doctor on this, and how do you guide us on this?
Yeah, I think it's a very important point to understand, and we as doctors need to understand that everybody of this category need a psychologic first aid. So we forget this term as first aid for psychology. So if a person is say hurt, you can't expect him to follow the guidance of mind body intervention from day one. He's not in a situation to listen to you. So there is something called as a mental first aid to be given to every patient. Now most of these first aids given to patients who are depressed, anxious is a small pill load given for a period of 8 to 10 days, and that does the initial job of healing. So basically, mental healing begins with medications, and if not all people are the category where they would require psychiatrist or they would require a psychological consult immediately. See, I am distressed in certain situations which are bad for me, and that is normal. So in that situation, just to overcome that temporary stressor, I can take the help of my doctor with the medicines, and small doses of antidepressants, small doses of anxiolytics can help me have good sleep, can relieve my depression, can make me exercise properly. I should do that. So lot of doctors and lot of diabetologists do that, and I think that's a very right practice which has been endorsed by the Indian Psychiatry Society, that you have to actually work for mental aid also of the patient when needed, and only patients who are grossly affected need to be referred to the psychiatrist. So you need to identify who really needs a psychiatrist and who needs normal mental health advice. So I think that category needs to be differentiated very well.
All right. Thank you so very much, Dr. Vishali. And there are some questions we'll try and take them as well. We have
Hmm.
Mr. Raghuvanshi who is asking that is rapid weight reduction is it common in diabetic patients and how to manage that? And it seems that this can also lead to a stress that what has happened to me? I've suddenly lost a lot of weight. So can you just help us understand this whole situation?
Yeah, weight is a concern both the ways. So increase in weight and fall in weight both is a concern for the patient and the doctor both ways. As a doctor, we are happy when the patient loses weight in a healthy fashion. So I quote the healthy fashion because most of the diabetics would have weight loss as a part of their uncontrolled status. So if that is the case, the patient is going to be suffering that loss of anabolic status of the body. So the patient will lose muscle mass, bone mass, and feel weaker when he loses weight. So you need to first see whether that weight reduction is healthy or unhealthy. So healthy weight reduction is fat loss, which is occurring with good glycemic control and with the presence of certain agents which decrease the visceral body fat. Like you know that the SGLT2 inhibitors are known to reduce the visceral body fat. So they would give some weight loss. So you need to identify that whether there is any reason for the weight loss, and if that reason is a healthy reason. If that healthy reason exists, then I think you are happy with that weight loss. You need to tell your patient that this is a good weight loss. You need not worry. Though it is rapid, we can decrease the rate of that rapid decline by tapering the medications, by helping the right eating, and probably protein supplementation. They may be deficient in the nutrition aspect of weight gain. So that is one thing. And if the patient is having an unhealthy weight loss, then you need to look into mind health, depression. You need to look into medications which are harming the patient in terms of weight. Then you need to look into other disorders like neuropathy and muscle wasting and neurological disorders where the patient is losing weight, and also thyroid disorders and adrenal disorders in diabetic patients can come with weight loss. So I think weight loss is a symptom of many things which are happening in the patient. So
Hmm.
we need to definitely ask into probe into this symptom and get the right feedback.
Yeah. So no, thank you very much, and I think the message is very clear. The weight loss is it can be both healthy as well as unhealthy. So and there can be various reasons. If someone is experiencing a quick, rapid weight loss, go and have a conversation with your doctor, and then you will know exactly what's the reason and what to do in such a situation. There's another related question, ma'am. Is the last one we'll take as we're running out of time as well from Mr. Nalavre, and he's basically talking about the interactions between stress management techniques. Are there any potential interactions? between stress management techniques and medications of diabetic. So maybe he's talking about like if someone is taking some medicines and then for relaxation is running, playing, doing so, can be it be inversely promote related? What should be done in such a condition?
So there needs to be a synchrony between the stress management techniques and the diabetic medication. So, for example, if you are giving say potent diabetic agent and asking the patient to follow a power yoga session or a trekking session, the patient is going to land up with hypoglycemia. So you need to tone down your medications accordingly. So secondly, if you're giving some sleep medication and you expect that the patient to be eating on the right time, and he doesn't read because he's groggy or sleepy or drowsy, or he's a night driver and driving at the night time, you are causing more harm. So I think lot of concerns are there when you are giving stress management technique. There is also a study which has shown that if you apply meditative techniques to people who are depressed, they might worsen into that depression state. So you need to know that which techniques are right techniques for which kind of a person. So a person who's already depressed and you ask him to interoceptive techniques, you ask him to follow, he might get into more depression. So I think it's better to have a right judgment from the patient as to what he or she would like to follow rather than prescribe in a blanket fashion.
Okay, so there can be a potential interaction, and it should be done in discussion with your doctor and under the right kind of supervision as well. Well, I think that's a very comprehensively covered discussion, ma'am, by you today. Thank you so very much, for giving us and sharing with us all the aspects around managing how to manage stress for people with diabetes. I must thank you here, and I also must thank all our viewers who have been, watching us live or who may be, listening to this program later on. If you have, anyone in your home, in your friends, family who is having diabetes and he may undergo such a situation, you can simply share the link of this program with them, and this discussion with Dr. Vishali can actually be very useful for them. And what she told today about the whole mind, body and medicine concept, I think that's very very interesting. And we must all understand this more and follow this more as well. But ma'am, before I conclude, I hand it back to you. In summary, if you like to say anything to our viewers, or if there is any important aspect which we have still missed and you like to cover, I give it back to you for your final comments.
Yeah, I would thank you once again for giving me this opportunity, and I enjoyed the discussion with you. And the viewers also have been very interactive and intelligent in asking their questions. And before I conclude, I would just like to say that mind is the driver of your body. So you have to make this driver healthy, and you have to control the mind. Otherwise, mind is going to control you and you are going to go haywire. So it is better you control your mind rather than the mind controlling you. So I think I always put this as my last quote, that you should be the controller of your mind, not the mind.
Well, that's great. I think those are some great words, and we all must remember this. Not only, if you have diabetes, but I think for anything you do in life, I think a positive mindset, uh, a positive frame of mind is very, very important. And whatever, you decide you achieve in life, first you achieve in your mind. And once you have achieved in your mind, then you start planning, implementing, and then you reach your goals also in life.
Yeah, they
So
say
on
that
that
the
note,
person
yeah.
lives in the mind. So I agree with that.
Yeah. So with that, we'll thank all our viewers, and Dr. Vishali will thank you as well for joining us tonight. And we would be very keen to invite you again to talk about other topics as well in times to come. Thank you very much, and good
Thank
night,
you.
everyone.
Thank you. Bye bye.